Hi everyone, welcome back to my channel, Professor Rivera-Mitu, where we make medical terminology simple, organized, and easy to remember. In today's lesson, we are covering prefixes, one of the most powerful tools for decoding medical words. By the end of this video, you will be able to define what a prefix is, identify common medical prefixes, understand how prefixes change word meaning, and build and break down medical terms with confidence. Let's get started. A prefix is a word element placed at the beginning of a word. It changes the meaning of the root word. Very important to remember that not all medical terms have prefixes. So if you don't see one, that's okay. The good news is most medical prefixes are the same prefixes you already know in English. For example, pre means before, post means after, anti means against. So you're not starting from zero. You're just building on knowledge you already have. Medical prefixes are grouped according to how they modify meaning. We categorize them into four major groups. Position, which tells us where something is located. Number and measurement, which indicates quantity or size. Direction, which shows movement or orientation. And other common prefixes, which is a broader category used to alter meaning in various ways. These categories help organize your learning and show patterns that appear in medical word building. Let's look at the examples. Epigastric. Epi means above or above the stomach. Intercostal. Inter means between, like between the ribs. Prenatal means before birth. Postnatal means after birth. And subnasal means under the nose. So instead of memorizing the whole word, you identify the prefix and it tells you the location. The prefixes of number and measurement describe how many, how much, the size, or degree of involvement. So in the slide, the examples are polyphobia, which means fear of many things, macrocyte, which is a large cell, microcyte, which is a small cell, quadriplegia, which means paralysis of 4 limbs, and triceps, which means 3 heads. So the prefix gives you a numerical or size clue immediately. Directional prefixes describe movement, path, or orientation. Circum or peri means around, extra means outside, intra means within, para means near or beside, supra means below, and trans or dia means across, and endo means within. So in the examples here, circumrenal means around the kidney, extracranial means outside the skull, intramuscular means within the muscle, paranasal means beside the nose, suprarenal means above the kidney, and endocrine means secrete within. These show the anatomical relationship between structures. It says change the condition or quality of the word. Antibacterial means against bacteria. Anesthesia means without feeling. Amastia means without a breast. Eupnea means normal breathing. Dyspnea means difficulty breathing or difficult breathing. Homograph means the same. These are extremely common in clinical practice. Let's practice applying these prefixes. On the following slides, I'll give you a clue or definition, and your job is to identify the correct prefix that completes the medical term. After thinking it through, we'll compare your answer to the correct one on the next slide. So on this slide, we have between, above or upon, after or behind, and under, below, or deficient. You can pause here if you need to think of the answers. So between means is inter, above or upon is epi, after or behind is post, and under, below, or deficient is hypo. So for example, between, we'll use the word intercostal, which means pertaining to between ribs. For above or upon, we'll use epidermis, meaning the outer layer of the skin, which is located upon the dermis. For after or behind, we'll use postoperative, meaning occurring after a surgery. For under, below, or deficient, hypoglycemia, which means low blood sugar. Next set, backward or behind, before, in front of, or under and below. So backward behind is retro, before in front of is pre or pro, and under below is infra or sub. Here's some examples. Retroperitoneal means located behind the peritoneum, which is your abdominal lining. Prenatal means before birth. Subcutaneous means beneath the skin. Here's another set. 4, large, small, and 3. The prefix for 4 is quadri. For large, it's macro. Small is micro. And 3 is tri. Here are some example medical terminologies. For 4, it's quadriplegia, which means paralysis of all 4 limbs. Macrocytosis, which means condition of abnormally large red blood cells. Microcephaly, which is an abnormally small head. And tricuspid, which means having 3 cusps or flaps, which is one of the heart valves. In this set, we have 2, first, 1/2, and none. Two is bi. First is primi or primi, depending on what word we're talking about. 1/2 is hemi or semi, or again, semi. And none is nully. Here are some examples. Bilateral, meaning pertaining to 2 sides. Primigravida, which is a woman pregnant for the first time. Hemiplegia, which is paralysis on one side of the body. And nullipara, which is a woman who has never given birth. In this set, we have double, one, and many or much. Double is di, dipl, or diplo. One, the prefixes are mono or uni. And for many, much, or is multi or poly. Multi can also be pronounced as multi. Here are some examples. Diplopia, which means double vision. Monocyte, which is a white blood cell with 1 nucleus, 1 cell. Polyuria, which is excessive urination. In the set, we have upper or above, from or away from, toward, or above, excessive, or superior. So the prefix for upper or above is super. From, away from is ab with a B. Toward is ad with a D. And above, excessive, or superior is supra. Here's some examples. So the superior vena cava is the large vein located above that returns blood to the heart. Abduction is movement away from the midline of the body. Adduction is movement toward the midline of the body. And suprapubic is located above the pubic bone. In these prefixes of direction, we have around, through or across, in or within, and outside or outward. For around, the prefixes are circum or peri. For through and across, it's dia or trans. In and within, it's endo or intra. And outside or outward is ecto, exo, or extra. Here are some examples. So pericardium is the membrane that surrounds the heart, so around. Transdermal, through the skin. Intravenous is within a vein. And extracellular is outside the cell. In the set of prefixes of direction, we have slow, rapid, different, or false. Slow is Brady, rapid is tachy, different is hetero, and false is pseudo. Here are some examples. So bradycardia means slow heart rate. Tachypnea is rapid breathing. Heterozygous means having two different genes for a trait. Pseudocyesis is false pregnancy. Here's some common prefixes. Bad, painful, or difficult. Good or normal. Bad. And union, together, or joined. Bad, painful, or difficult is the prefix dis. Good or normal is eu, eu. Bad is mal. And union, together, or joined is syn, syn. Here are some examples. Dysphagia is difficulty swallowing. Eupnea is normal breathing. Malnutrition is poor nutrition or bad nutrition. Symphysis is a joint where two bones are joined together. Here are some more common prefixes: without or not, against, and same. Without or not is a or an. Against is anti or anti, and contra. And same is homo or homeo. Here's some examples. So anemia is a condition without enough red blood cells. Anticoagulant is a medication that works against blood clot. Homogeneous is composed of the same type throughout. Now let's look at some exercises with some of the suffixes or word roots here given to you, and I need you to complete the words. Paralysis of four limbs is blank plegia. Three heads is blank seps. And pertaining to one nucleus is blank nuclei, and then there's another part at the end. So paralysis of four limbs is quadriplegia. Three heads is triceps. And pertaining to one nucleus is uninuclear. So there's a suffix there at the end of AR, which means pertaining to. Here's another set. Pertaining to between the ribs is blank, coast, and then another blank. Pertaining to the period after birth is blank, nate, and then another blank. Double vision is a blank, and then opia. Pertaining to under the skin is a blank, derm, and then another blank. Here are the answers. Pertaining to between the ribs is intercostal. Pertaining to the period after birth is postnatal. Double vision is diplopia. Pertaining to under the skin is hypodermic. Here's another set. Flow through is dia blank. Pertaining to around the kidney, blank, ren, blank. Pertaining to outside the skull is blank, crani, and then another blank. Flow heart rate is blank, and then cardia. The answers: flow through is diarrhea. Pertaining to around the kidney, circumrenal. Pertaining to outside the skull, extracranial. Flow heart rate, bradycardia. Couple more sets. Without feeling is blank, aesthesia. Childbirth that is bad, painful, or difficult, blank, tosia. Pregnancy that is false, blank, sciasis. Breathing that is rapid, blank, nia. The pronunciation of this may change based on the answer in the front. So here's the answers. Without feeling is anesthesia. Childbirth that is bad, painful, or difficult is dystocia. Pregnancy that is false is pseudocyesis. And breathing that is rapid is tachypnea. So let's build these words. Paralysis of forelimbs. Instrument for examining small objects. Cell that is large. And fear of many things. The answers: paralysis of four limbs, quadriplegia, instrument for examining small objects, microscope, a cell that is large, macrocyte, and fear of many things, polyphobia. Here's another set of exercises pertaining to or around the kidneys. Secrete within, pertaining to one nucleus, and pertaining to near, beside, or beyond the nose. And the answers pertaining to around the kidney is circumrenal, secrete within, endocrine, pertaining to one nucleus, mononuclear, pertaining to near, beside, or beyond the nose is paranasal. Here's one more. Double vision, paralysis of one half of the body, pertaining to under the skin, and pertaining to under the nose. Double vision is diplopia. Paralysis of one half of the body is hemiplegia. Pertaining to under the skin is hypodermic or subcutaneous. Pertaining to under the nose is subnasal. Here's one more. Pertaining to two sides. Pertaining to the period before birth. Pertaining to between the ribs. And turning backward or behind. Answers pertaining to two sides is bilateral. Pertaining to the period before birth is prenatal. Pertaining to between the ribs is intercostal. And turning backward or behind is retroversion. Now, if you're viewing this YouTube video and you're one of my students, then you will have a prefix application exercise in the Canvas course. So these are the exercises, and you will write your answers in Canvas. Here's number 1 through 5, and we will have 20 of these. Number 1, pertaining to above the kidney. 2, pertaining to within the muscle. 3, pertaining to around the nose. 4, pertaining to outside the skull. 5, pertaining to below the skin. Number 6, cell with one nucleus. 7, instrument for examining large objects. 8, many fears. 9, muscle with two heads. 10, half paralysis. 11, secrete outside. 12, flow across. 13, pertaining to within the skull. 14, movement away from the midline. 15, pertaining to around the heart. And here's the last set. Number 16, painful or difficult breathing. 17, normal sensation. 18, false tissue graft. 19, without a breast. And 20, against bacteria. You will be building the medical term using the correct prefix plus the word root that is given in each of the questions. Make sure that it's spelled correctly, and you don't have to put any slashes in between the word elements. You just write the entire medical terminology. Good luck.